The province of Misamis Oriental has a total population of 939,038 with a poverty incidence rate of 14.9%. There are 23 municipalities and 2 component cities with 424 barangays. MLGP engaged 17 municipalities have already graduated, and there are 194,031 households. We have the NBS facility, 32, 8 Misamis Oriental provincial hospitals, 3 municipal hospitals, 2 private hospitals, 2 lying-in, 1 barangay, 16 rural health units. Number of barangay health stations, we have 396, and number of rural health units, 25. Number of MCP PCB accredited RHUs, 14 out of 25 municipal rural health units. Number of licensed government hospitals, we have the 8 provincial hospitals, the Misamis Oriental provincial hospitals, plus 1 municipal hospital. We have the common problems in the province of Misamis Oriental: high number of maternal deaths, 1 facility-based, and 5 place of occurrence. Low percentage of antenatal care with 4 visits. The province has only 64%. There is also lack of birth and emergency plans, specifically teen pregnancy. Low percent of pregnant women given TT2+, which is equivalent to 55.18%. Iron with folic acid, 63.86% only. Low percentage of health facilities accredited by PhilHealth, 56% out of 25, only 14 has or are MCP accredited. High percent of 10-age pregnancy, which is about 11.97%. High percentage of PPIUD trained but not actually performing IUD insertion. There is an inadequate budget support allotted for family planning program. Low percentage of organized and functional RPRH council, which is 50% only. Low percentage of PPIUD trained given certificate of training by the DOH, CHD Northern Mindanao, and endorsement of PhilHealth for claim purposes. Low percentage of health service providers on the use of adolescent job aids and adolescents on peer education. We also have a low fully immunized children coverage, which is equivalent to 78% only. Low coverage of MMR, 68%. Low percentage of RHU performing NBS, 40%. Low percentage of exclusive breastfeeding until 6 months, 73%. On family planning, there is already an approved provincial implementation team and adoption of EO12. We also have municipal and city implementation teams of the 23 municipalities and 2 cities. There is also a tracking of unmet needs, house-to-house survey by BHWs, BPVs, and BNS. Conduct of data quality check, which is done quarterly, and there is a strong partnership with other public and private partners. An installation of family planning room in the 8 Misamis Oriental hospitals had been done, and conducted quarterly meetings with MPOs and BPVs and social mobilization. Conducted also provincial Purple Ribbon awarding in 2017 and in 2018, and we had 11 regional entries. There is a continuous trainings, orientations on FPCBT1, FPCBT2, PPIUD, PSI, and NFP. MCH, we have the Safe Motherhood semi-annual and annual Manchen PIR. There is also a conduct of Bontis Congress in Lugait, Initaw, El Salvador City, Taguluan, Villanueva, and Balingasang. A conduct of quarterly maternal death review is being done. Conduct meetings with hospital staff on MDFHI. Inter-school advocacy on adolescent health had been also done, and extended laboratory and ultrasound services to far-flung barangays and catchment areas for pregnant women done in Villanueva. On the expanded program of immunization, there is a regular conduct of annual data validation, data analysis, and finalization of accomplishment report. Annual review of TCL is being done by municipality. Regular delivery of vaccine based on the monthly collection and submission of VSSMM from the PHO and other logistic support, and they conduct regular monitoring and evaluation evaluation on EPI implementation. On newborn screening, there is a reunion of G6PD babies on the eastern town of the Interlocal Health Zone. Newborn screening regional evaluation in February 19 to 20, 2018 at the Lux Hotel was being done. Provided lectures during Buntis Congress activity. On nutrition program, celebration on garantisadong pambata through conduct of dental services to children and demonstrations on and toothbrushing activity. IEC on breastfeeding and micronutrient supplementation was also done. Monitoring on the breastfeeding activities, pre-assessment of hospital in preparation for regional assessment with PHO breastfeeding team. Private companies, bus terminals on Republic Act 128 compliant. Advocacy and orientation on 1,000 days activities during Buntis Congress and breastfeeding forum also done at Pearlmont Hotel. We will be showing to you our 2018 accomplishment in comparison with our 2017 accomplishments. Antenatal care, 4 visits, and this is by municipality and by city. Facility-based delivery by municipality and by city. Then skilled birth attendance by municipality also and by city. CPR or the contraceptive prevalence rate. Fully immunized child. If you compare this with our CPR has gone up, so our fully immunized child has gone low. Exclusive breastfeeding. Newborn screened for metabolic disorders or the NBS. We now go to the adolescent program, adolescent birth rate. Nutrition, underweight and severely underweight. Wasted and severely wasted. Stunted and severely stunted. And we now come to our way forward with Manchen, reactivation of Women's Health Team, collaboration and coordination meeting with City Health and hospital facilities, conduct of MDR, DQC, and PIR, strengthen also pregnancy tracking, recordings, and reporting, advocacy and monitoring on the implementation of AO 2016-0035. The mobilization also of BHWs on master listing, profiling, and navigation of mothers on prenatal checkup. On family planning, inventory to personnel oriented on RPRH law. Orientation also on RPRH law. Request LGUs for a policy ordinance to allocate budget for family planning. PTE for PPIUD and FPCB2. Fertility awareness to in and out of school youth. TOT on fertility awareness. Conduct updated master listing of MWRA in every barangay. Provide family planning commodities, drugs and medicines, medical supplies to health facilities, and purple ribbon activities and awards, monitoring and evaluation of family planning activity. On newborn screening, provide augmentation supply of NBS kits, request LGUs to allocate budgets for the purchase of NBS kits, intensify IEC on the importance of newborn tests after birth. On EPI, we have tracking of defaulters at all levels, training on EPI and cold chain management to newly hired personnel, data quality check at all levels, reactivate the spot mapping per households by barangay health workers, intensify monitoring and evaluation on EPI implementation at all levels. On nutrition, refresher course in IYCF, pabasa sa nutrisyon, breastfeeding forum, health, nutrition, and updates to health providers, GP celebration, regular monitoring on nutrition activities and ASIN law implementation, funds to provide additional tools for child assessment using WHO Child Growth Standard, training on health providers on micronutrient supplementation using MOP and WHO Child Growth Standards, consultative meeting to prove recording and reporting and master list of BHWs. Thank you.